Morning, everybody. I just want to start by acknowledging again a record number of tests and the good news of the limited days of exposure in the community. That augurs well to everybody who's looking for a way out of this, and the fact that Queenslanders have rallied in this way is nothing short of amazing. What isn't amazing is the heartache that we're hearing from small and family business. And I just want to relay two stories because they are from different sides of the spectrum, but they indicate just how tough things are right now. This morning, the Shadow spokesperson for small and family business, Brent Mickelberg, spoke with someone who was a wholesaler in the food business. He has received overnight 4 emails from people in the hospitality business, primarily restaurants, who have indicated to him that they are closing their business as a result of the ongoing pain caused by this. On a similar scale, another retailer who reports that they yesterday closed because they felt that they were not an essential service, and in the same street was a national retailer selling similar goods to them. The lack of clarity in messaging is hurting that business. It's leading to some issues in the mental health space, and I think you're going to find in the weeks ahead you're going to see a rise in people in small and family business who are suffering, and so now is the time for all of us, whether or not you're in that space or you have loved ones who work in that space, to convey the message that if they need help, they need to seek it, and they need to seek it now. And you're not I understand how important the viability of your business is and how much you're working on it, but your mental well-being is pretty bloody important as well. And they need to reach out for help because we're hearing some very tough stories. I want to again ask the government to look at the COVID business support package and have a look at doing 3 things. One is immediately implementing a sliding scale, and that will enable those sole traders to be picked up who otherwise currently miss out. And that will enable a larger quantum to go to the businesses who need a little more than $5,000 to keep the lights on at the moment. That's got to be done. I want them to accelerate the application process, and finally I want them to accelerate getting that money out the door. When you have a situation that overnight 4 restaurants have viewed that even with that money coming, they can't stay afloat for even 2 weeks to hold on for it, that should scream out to the government that the package isn't going to hit the mark unless it's amended. So we stand ready. On over 100 occasions I've called for one, and I ask the government, please be nimble, be fleet of foot, and find a way to make that money hit where it needs to in a quicker way. I want to see some clarity around what is an essential worker, and I want to see some clarity around things like online shopping, because quite frankly, it's when you have a situation where business groups are saying that they're putting forward a list in their mind what constitutes an essential worker, an essential retailer, but the government is saying, in the case yesterday of the Health Minister, well, don't worry about the legal advice, just find a way through. That is breeding confusion, and it has to be stopped and it has to be clarified. Queenslanders need certainty in uncertain times, and if the health advice around online shopping has changed, well, so too must the compensation available to keep these businesses afloat. It's that simple. I'll hand over to Ros.
Well, good morning, and fantastic news again today that over 52,000 people have gotten tested. We also heard that we need to keep up those testing rates of 50,000 a day in order for us to get out of this lockdown. About vaccinations again. Talk to your GP and get your vaccination. Talk to your GP and get vaccinated. It's that simple. The other issue I wanted to address is the Griffin report, which is due tomorrow. We know that report came out of an outbreak at the PA hospital when an unvaccinated staff member was sitting outside the COVID ward. We want to know exactly what happened. The public need to know what happened. We need to know what infection protocols have been put in place to make sure that it doesn't happen again. We need to make sure that Queenslanders are not plunged into another lockdown because of an outbreak from our hospitals or from our hotel quarantine.
Thank you. Well, the current package of $260 million, on my count, that would be able to assist 1 in 9 small and family businesses. Now, CCIQ say that based on the current schedule, 2/3 of businesses aren't even going to be eligible. It's going to take a lot more than $260 million. Now, the government budgeted absolutely nothing. Now, that wasn't through lack of warning. We consistently asked them to do so. But we are where we are at the moment. And what I want to see is a package that can help people stay afloat. They need it at the moment. They need that clarity and they need that certainty. So it's up to the government to find a way through, but the greatest gift they can give small and family business is the certainty that someone will have their back tomorrow, because otherwise they're closing today. That's how dire it is. People are handing back the keys. They are walking away from a lifetime of dreams, and we can't let that happen. I'm not okay with that, and neither should the government. And I want to know that we've got a package that can deliver money quickly, that it can be the right quantum, and then in years to come they'll thank us for allowing them to continue to employ Queenslanders, because that's what they do. They get up out of bed every day and they create jobs for people who have their own families, have their own dreams. But at the moment they can't see a way through. And a package of a one-size-fits-all that you can't even apply for another fortnight, that's not going to keep those hopes burning. Well, not every small and family business is going to need it. I acknowledge that. But they certainly need access to it immediately, those who need the help. And the problem with delaying it over this period of time is you're going to have a situation where people are going to need a heck of a lot more money than if it was given up front. Right now they're making decisions on cash flow, and if they know they've got that, they can look the bank manager in the eye and say, I can get through this. But a delayed process of not even putting in an application for a fortnight, and then who knows when the money's going to flow, that's not going to cut the mustard. If you're someone who turns over less than $75,000, you can't even get access to anything. Now, in the case of New South Wales, there is a sliding scale that allows that to tap into. And then you have larger businesses, but they're still small and family business. And I spoke to one this morning who his overheads before he opens the door is about $20,000 per week just to keep the lights on. Well, $5,000 isn't going to change his ability to stay afloat. It needs to be a sliding scale, and government's never going to be able to help everyone. I acknowledge that, but a nimble, targeted, sliding scale package delivered in a more timely fashion will help a lot more people than a one-size-fits-few approach that we're seeing at the moment. No, but I do think we need to do all we can to remove confusion around vaccines, and there is vaccine hesitancy in the community. Now, I'm not convinced that giving people money is a way to remove that hesitancy. The way to remove the hesitancy is for leaders to stand up and lead. And I've been consistent in my messaging that we absolutely need to get vaccinated to get the show back on the road. And that's not just economically, that's also socially. If you want to reconnect with loved ones, if you want your kids to go back to school, if you want to know that the business at the end of the street is still going to be open in a few months' time, do your state a duty and go and get vaccinated. Thanks. Thanks very much.